Welcome to the topic, drugs for eye and ear disorders. So the knowledge of the basic eye anatomy is very essential for an understanding of the eye disorders and the drug therapy. So first we will understand how the eye is anatomically. So this is internal structure of the eye. We can see here, they are starting from anterior cavity. Then we have cornea in the front, the white portion. We have the edge of the pupil here. Lens, this is the white color inside iris that gives the color to the eye, which is blue, gray, green. Conjunctiva is the other white side. Then we have here the white portion going towards the back is the sclera. Inside where the image is being made, that is the retina. But then is the posterior cavity and anterior cavity. So anterior cavity contains aqueous humor and the posterior cavity contains the vitreous humor in that. Then we have orbital fat outside the eye. We have optic nerves over here. We have the central arteries and the veins, which gives the blood supply to the eye. We have a fovea centralis, which is a blind spot of the eye where the visual axes are being made. So this is just an internal structure of the eye quickly. So normal eye looks like normal, and when a person is having a glaucoma, so the glaucoma eye looks like that. There is a buildup of the aqueous humor at the front of the eye, and this pressure, it's going to go to the back and the damage to the optic nerve occurs. So that's why the glaucoma becomes one of the leading causes of the blindness because of the buildup of the aqueous humor in front of it. So if the humor is being built up, it means we need some drugs to take the humor out or to decrease the pressure at the back. So the optic nerve should not get damaged. So glaucoma is characterized by increased pressure inside the eyeball, which is termed as the intraocular pressure or IOP. Then the flow of the aqueous humor, it becomes blocked there. And over time, the pressure around the optic nerve can build, leading to the blindness. And in some cases, eye injury may be sudden, but in most cases, it is gradual. So what are the two principal types of that? One is the open angle glaucoma, which we were just discussing about it, or called as the chronic simple glaucoma. It is the most common type of the glaucoma. Intraocular pressure develops more slowly in it, and iris does not cover the trabecular meshwork. Discovered early, when can be treated with medications, if it is discovered early. And the other is the closed angle glaucoma, which is the acute glaucoma, in which usually it occurs by stress, impact, injury, or some medication side effect. The pressure increases suddenly because the iris is pushed over the area where the aqueous fluid drains normally. So symptoms include intense headaches, difficulty concentrating, bloodshot eyes, and the blurred vision. Usually, it requires immediate surgical intervention in closed angle glaucoma or acute glaucoma. Now, this glaucoma therapy, it focuses on adjusting the circulation of the aqueous humor. So aqueous humor, we circulate it and we're gonna work with that glaucomal therapy. How it works? Either conventional or laser surgery to return the iris back to its original position. And the most therapies, they focus on reducing the amount of aqueous humor formed on unblocking its drainage. Our goal to decrease the intraocular pressure. The drugs therapy for the glaucoma, they functions by, I explained, either we're going to increase the outflow of the aqueous humor through the canal of the Schlemm, or we're going to decrease the formation of the aqueous humor, which is at the ciliary body location. So some anti-glaucomal medications, which increases the outflow of the aqueous humor, there are present. So we're going to use those ones. So those anti-glaucoma drugs are prostaglandins. It's a preferred drug of the choice. It's dilate the trabecular meshwork to increase the aqueous humor outflow and reduce the congestion. We use miotics, which causes the pupils to constrict, which are the cholinergic direct or indirect action. We have sympathomimetic drugs that mimic the activation of the sympathetic activity, causes the pupil dilation. And IOP, increased intraocular pressure, is reduced when more aqueous humor is absorbed. So now other anti-glaucoma medications that decrease the formation of the aqueous humors are the beta-adrenergic blockers, which reduce the IOP but do not alter the pupil diameter or produce the cycloplegic effects. Alpha-2 adrenergic agents, carbonic anhydride inhibitors, and osmotic diuretics are the drug classes that decrease the formation of the aqueous humor. The second choice to the beta blockers is the alpha-2 adrenergic agent if they are not effective. Then the drugs, they provide the relief for the minor eye conditions and are also used for the eye examinations. The minor eye conditions, eye medications includes antimicrobials, local anesthetics, corticosteroids, and the non-steroidal anti-inflammatory drugs. The drops, the salves, optical inserts, and injectable formulations, which include some agents, they only provide the moisture to the eye surface, and others, they penetrate and affect a specific area of the eye. When we do the eye examination, which is the drugs designed for ophthalmic examination, we either dilate the pupil, we can see the pupil in the bright light is like that and pupil in the dim light is like that. We do some ophthalmic examinations where we use the cycloplegic drugs to relax the ciliary muscles and the mydriatic drugs to dilate the pupils. So this is about the otic preparations now. We're going to talk about the ear a bit. Otic preparations, they treat infections, inflammations, and absolutely the earwax buildup. So this is a little structure of eye that it looks like. It has the two major sensory functions. One is hearing and the other is maintenance of the equilibrium and balance. So it includes outer ear, middle ear, and inner ear. They all perform these functions. Ear conditions, external otitis, which is the inflammation of the outer ear, which is called a swimmer's ear. But then we have otitis media. It can be inflammation of middle ear, which occurs due to upper respiratory infections, allergies, or auditory tube irritation. Otitis interna, as the name suggests, it's an inner ear infection. It is most difficult to treat. Then we can have mastoiditis, which is inflammation of the mastoid sinuses. If it's untreated, it can result to the hearing loss as well. So drugs for the otic issues, either ear infection, then topical antibiotics in the form of the ear drops may be administered for the external ear infections. Systemic antibiotics may be used if the outer ear infections are extensive or in cases of the middle or inner ear infections, and medications for pain, edema, and itching. Ear infection, we use glucocorticoids, which are often combined with antibiotics or with other drugs when inflammation is present. Or for earwax removal, we can use the mineral oil or the earwax softeners. Then this is the structure of the external ear, which has the auricles, external auditory canal, and tympanic membrane. Then we have the middle ear, which has the three bones, malleus, incus, and stapes. These are the smallest bone in the body. Then we have the inner ear, which includes vestibule, semicircular canals, cranial nerves, cochlea, round window, eustachian tube. So they are all the parts of the structure of the ear. So the drugs, they are used for the eye and ear disorders. Alpha-2 adrenergic drugs like apraclonidine, brimonidine, tartrate. Beta adrenergic blockers, bitoxolol, levobunolol, timolol. Carbonic anhydrase inhibitors is acetazolamide, brinzolamide, dorzolamide, and methazolamide. For cycloplegic, anticholinergics are atropine, cyclopentolate, hometropine, scopolamine, and tropicamide. There are some direct and indirect acting cholinergics are also called as meiotic drugs like carbachol, ecothiopate, and pilocarpine. Drugs for the corneal edema and itching includes the sodium chloride, hypertonic, ET ointment. There are some general purpose lubricants like lanolin alcohol or polyvinyl alcohols. Lubricants, they cause the vasoconstriction, nepazoline, oxymetazoline, tetrahydrozoline. We have some mydriatics, sympathomimetics, phenylephrine. We have non-selective sympathomimetics, mydriatic drugs, dipiwefferin, hydrochloride. We have osmotic diuretics, which is isosorbide or mannitol. Some otic preparations, antibiotics and steroids, ciprofloxacin and dexamethasone, ciprofloxacin and hydrocortisone, polymyxin being neomycin and hydrocortisone. We have some otic preparations which loosens the earwax as the carbamide peroxide. Otic preparations which are topical anesthetics, which is benzocaine and antipyrine. We have prostaglandins, bimatoprost, latanoprost, and travoprost. The summary of the whole eye and ear is it gives us the knowledge of the basic eye and ear anatomy, resists with the understanding of disorders. Glaucoma, if untreated, it can cause the blindness. Treatment and medication focus on the aqueous humor circulation. Minor eye conditions and the examinations are treated with a variety of drugs. And otic preparations can help control the ear infections, inflammation, and earwax buildup. Thanks for watching.